If you have a smart speaker, you have access to the entire world of NPR and St. Louis Public Radio. All the latest news and all the captivating stories. Activate our voices with yours by telling your smart speaker to play St. Louis Public Radio.
Hello, and welcome to the Politically Speaking podcast. I'm your guest host today, Jason Rosenbaum. Chris McDaniel is unfortunately sick today. Joining me in studio is
Joe Mannies.
And
Sue Allen.
Yeah, and Jason and Sue Allen both have probably what Chris is at home with.
yes, just for full disclosure, both me and the state representative have had this strange, cold that affects our voice. So if my voice starts cracking, that's why. I know your voice will be pristine, so I'm not too worried about you.
At this point, I sound like an adolescent male.
And I had this about 2 weeks ago, so.
Everybody apparently has gotten this. So thank you very much. You're a first-time guest. We've had a lot of repeat guests recently, so I'm always overjoyed to throw a new person into the Politically Speaking mix.
But Representative Sue Allen is not new to politics.
No, not at all. First of all, tell me a little bit about your district and your House district and where it encompasses, essentially.
Yes, my House district number is 100. So basically, I represent the pretty much the southern part of Chesterfield, the western, possibly northwestern part of Baldwin, one precinct of Town and Country, and Winchester.
But you live in Town and Country.
I
correct?
do live in Winchester. I do live in Town and Country, and that's the one that's the one precinct that I have from Town and Country.
I just want to say, for full disclosure, and people who have listened to this show know that my grandfather lives in Chesterfield. He lives in Bill Otto's district, and I am always thrilled to have anybody who represents Chesterfield on the show. I'm biased towards Chesterfield.
Chesterfield is a great community.
Yes. So you were elected in 2008, and you succeeded Representative Charles Portwood. But before we get to that point, tell me a little bit about yourself and how you decided to get into state politics in the first place.
Okay. I'm a physical therapist, and for many years, I would visit my legislators, my senators and representatives in Jeff City to lobby for issues related to physical therapy, related to children, related to healthcare in general. In 2005, when Governor Blunt left out the Missouri First Steps, or the early intervention program, from the budget, I guess I got the call and I was headed to Jeff City in an hour on a Monday morning, and I worked with then Senator Mike Gibbons, who was my senator at the time. And we got Senate Bill 500, which then put the early intervention in Missouri in statute. And frankly, that's the best thing that ever happened to that program, because every year prior to that point, DESE, Department of Elementary and Secondary Ed, had been needing to go back to the body in the third quarter for supplemental funding. So that's changed, and I was happy to do that.
Yeah, putting it in statute gives it some permanence, essentially.
Yes, it wasn't. It couldn't be taken away at the whim of somebody just to pull it out of the line item out of the budget.
So, yeah, but you decided to run for office in 2008.
Did you get encouragement from any particular people?
I was encouraged by then Senator Gibbons. My representative when I was before we moved to Town and Country was Richard Byrd, and I was very close to him. And then he died.
Right.
And then when we moved to Town and Country, first thing I did, I contacted Representative Portwood before I even moved, because I knew I was going to be working with, needing to have a relationship with him. So he did not discourage me. He didn't necessarily encourage me. Well, he did encourage me, but he didn't openly support me. And that was after he had some problems. And so he he did not help or hinder me, and
Now,
probably
I had to
did
look
fine.
up. I had to look up the Secretary of State's results because that was not a race I was following. You did have a primary, but you won with about 69% of the vote. So that seemed to be a pretty resounding victory for you. And it's a heavily Republican district. So really, that first primary victory was pretty crucial.
Yeah, I had a primary, and actually it was against one of the Manchester aldermen.
Oh,
And the district then was the 92nd, and that was Town and Country and Manchester.
yes.
And then the unincorporated areas around Queenie Park.
So
So I won that.
would you say that was your toughest election, the primary, and since then it's really been not very difficult? Is that a fair assessment?
Well, that was my only primary, and I just got out and did the work. I don't have anything to judge it by. I was out there all the time.
Yeah, because we had Scott Sifton on recently, and his experience running in elections where it's very, very 50-50 is a lot different from when you run in a heavily Republican or heavily Democratic district.
So it's where it's mainly establishing yourself within the GOP ranks. When you're the same thing is true with the Democratic
Absolutely.
district. It's usually the nasty primaries. So quickly, you established yourself in particularly key areas. You want to talk about the major areas that you're interested in and what you're involved in the State House.
Well, as a physical therapist, initially I assumed I would be related, working in the areas of healthcare. And my first term, I was in healthcare policy. During my first and second years, I realized it doesn't matter how good a policy is. It depends on what the cost and how we implement and can afford any policy. So my second term, then I was placed on the House Budget Committee, and I was on the Appropriations for Health, Mental Health, and Social Services.
And from what I understand, the House Budget Committee obviously consists of the overall Budget Committee and then all these appropriations. I don't want to call them subcommittees because they are standalone committees, but they basically are responsible for going through the budgets of certain departments, which then kind of create the overall budget. Is that correct, or am I misstating that?
No, that's correct.
Okay.
And though within the the appropriations of health, mental health, social services, and I'll just call it the appropes. But,
Yes. It's a mouthful, so we'll
is.
do that.
Okay, thank you. And so we typically started off responding to the recommendations, the requests from the departments, the governor's recommendations, and looked at those as closely as we could. Very quickly, we recognized that we are given only the information that individuals are really wanting us to see. So very quickly then, and the current vice chair of budget, Representative Flanagan, who was at this term the chair of the Appropriations Committee, we started looking very closely. We got charts looking at the previous 5 years of spending and programming and withholds and growth, and just we kind of went down into the weeds to get a better feel. Now, my background, I'm very familiar with a lot of these programs, and so this committee evolved, and we didn't just look at then what the requests and recommendations are. And typically what you do, you look at, you create what the Appropriations Committee is going to recommend to go to the full Budget Committee. And we did that. But at the same time, we continued to work and dig down into the weeds and take a very active role in oversight of these three departments.
Now, is Medicaid one of the things that your committee deals with, or is that a different committee?
No, Medicaid is a part of social services. Social services is made up of Medicaid, which takes money from 4 different departments.
Correct.
And then also in social services, you have family support, which includes the welfare programs
Yes.
of TANF, Temporary Assistance for Needy Families, and food stamps. And it has the Children's Division and Division of Youth Services. So and there are a couple other small ones, or smaller compared to these. But yes, Medicaid is a key part.
Of your committee.
Yes.
So, since 2009, I think that the Governor Jay Nixon, at various times has proposed different ways to expand Medicaid. I remember in 2009 there was a proposal out there that would have used like hospital money.
Yeah, no state money. It would have, the
to
hospitals were
expand it by a certain percentage point, and now that didn't end up passing, obviously. And then we're at a point now where he's been kind of barnstorming to different kind of intervals about expanding it under the auspices of the Affordable Care Act to 133% of the federal poverty level.
which would add or expand benefits to about close to 300,000 Missourians.
Right.
Which was roughly the same number that either lost or got their benefits curbed back when there was the round of cuts in 2005, which is before the current representative's time.
Yeah.
But yeah, so he's been pressing that because this year, 2014, as we're ending, was the first of a 3-year portion where the federal government was paying all the costs of the expansion.
Now, what I'm kind of getting at is you were just talking about, even though a situation or a policy may seem like a good policy, the devil is really in the costs. And many Republicans have said, even though you're paying 100% by you, I mean, the federal government is paying 100% of this expansion for the first 3 years, the state has to pick up the tab eventually. And that's been one of the biggest contentions against it.
Under the expansion, the federal government picks up at least 90% of the costs forever.
Well,
But what the Republican contention is that the federal government doesn't have the money to be doing that.
so, okay, that was a big explanation. It's all stuff that you already
Right.
know, obviously.
But this is for our listeners.
What's kind of your view of this entire push for Medicaid expansion, and do you think that it will ever find favor in the legislature that's heavily Republican?
Okay. Well, first of all, currently the federal government gives us a 60-40, 60%
Correct.
Fed,
Correct.
40% state dollars. And that's for the existing population,
Correct.
age blind and disabled, and poor, very poor, under adults, women who have children, and then and people, adults under the 19%
Correct.
federal poverty
Yeah,
level.
because Missouri has one of the most restrictive requirements for adults anywhere in the country.
Yes, but we also have one of the most generous
Correct.
programs for children.
Yes.
Our
Correct.
CHIPS program takes children up to the 300% of the federal poverty level. So that's always been something that was a key issue for me. I don't want to see coverage for children to go away. Now, the expansion population, just to clarify, those are non-disabled adults without children. So after the federal money goes away in mass, then the state would pick up that 10%.
Correct.
Now, if you look at the overall budget of Medicaid, it's a lot of money. And I have some numbers here, but I think it's close to $8 billion.
I think
$800 million.
Yeah, it's
Okay.
it's a lot of money, basically.
Yeah, it's a lot of money, and I want to clarify. I'm a physical therapist. I'm not a numbers person, and I always think, okay, these are big numbers. We have wonderful analysts, but I look at the process and the ways that which we operate. So, but yes, it's a lot of money.
Yeah, because most of the estimates have said the state portion would eventually be somewhere between 100 million and 200 million when they have to pick up that 10%.
Right. And just an example, and I don't know the total comparison of demographics of Missouri with Ohio, but Ohio has expanded Medicaid. And I was recently in Washington, and I was told by someone who should know that Ohio is having increased expansion costs quarterly at $250 million.
Of course, Ohio is a much bigger state.
Okay, so it's got a better population, but we have to know that we are going to have growth even within, and we have growth without expansion.
That's true,
right
because
Correct.
every time I see a budget from year to year, the Medicaid cost is usually higher, and it may have stuff to do with just the growth of the population, or maybe just the amount of federal money is fluctuating. I'm not entirely sure, but you that is probably a consequence of that, and
Sure
not
it is.
probably. It's
Do you foresee any situation where the state, I mean, let's say that more states, of course, expand as Ohio has done, because Ohio has a Republican governor. Indiana is expanding. They have a Republican governor. Arkansas has expanded. They have a Republican governor. So you have a number of states with Republican governors who are participating
just
in the
one
Medicaid
quick
expansion.
correction, though. Arkansas has a Democratic governor now.
Right, but I meant,
Yeah.
And
correct.
Indiana
Correct.
has applied for a waiver, but
Correct.
they have not received that. So they may or may not be
Okay,
expanding.
yeah, that's
So
true.
Indiana,
That's true.
But continue your question, Joe.
Okay, so my point is, do you foresee any circumstance where the state of Missouri would participate in Medicaid expansion, or do you think that sort of it's not going to happen, so they need to be focusing on other things?
I believe it's not going to happen. In this last budget for 2015, we presented numerous ways to reform Medicaid, where there would be a significant return on investment, dollar-wise, but also for the benefit of the population, so human-wise, and for health, for prevention, and for helping people, in that current Medicaid population do better. We expand, we take the, when we come back and need to spend more and more and more every year on more Medicaid, those dollars have to come from somewhere. And we have not had a booming economy, and I'll say that with tongue in cheek because we haven't had growth. But so the money, it would have to come from education, and everybody knows how that would work. There are other areas it would come to. Now, we also, the voters in 2010 voted against Obamacare. Y'all remember that?
Yeah,
the freedom of healthcare.
Yeah, in the primary. And although some say that the August primary in 2010 was probably Republican leaning for various reasons, including the fact that it was on the ballot, and because the Democrats didn't campaign against it. But that said, I think most people agree that even though the numbers might have changed slightly, it probably would have passed, even if there had been a campaign against it.
Yes, and then the following, within the next 2 years, we also had a vote against having an exchange.
A state exchange with that, unless the legislature approved it.
Exactly.
Yes. But what we have, and I keep uncovering and finding out more, we actually have many ways, many provisions that the departments operate under the current administration, implementing many provisions from Obamacare. So, in a sense, we do have ACA or Obamacare functioning in Missouri.
Anything in particular that you want to mention that's implemented, even though?
Well, a lot of these 90-10 matches, and I have, the health homes come from the ACA. There are Medicaid primary care rate changes that came from ACA. Medicaid expansion is a key portion. Medicaid expansion is Obamacare, is ACA. I mean, I've got 5 or 6 pages
Sure.
and you
Okay.
can see the MAGI, modified adjusted growth income. That's from Obamacare. And so as the departments are refiguring the way of which someone becomes eligible for TANF or current Medicaid that we have, or food stamps, or any of these welfare programs, that is being implemented according to the MAGI, which is from the ACA.
Yes.
So when we say we don't have Obamacare, that's not quite clear. It's not quite accurate.
So let's kind of segue into another thing that you were involved in, I think either in 2012 or 2013. Representative Allen was the chairwoman of, I think, an interim committee or a special committee that looked at the structure of St. Louis County. That's obviously become a very big issue. It was a big issue before Ferguson, but now it's become an even more pertinent issue because people around the country have looked at how St. Louis County is divided, and people are thinking
90 municipalities.
90 municipalities, my oh my, stuff like that. So before we get into some specific things within that committee, which includes the sales tax pool, which is a political science professor's dream, kind of tell me what you found out in that committee and what you think maybe the county should take from that experience, because it's a big issue right now. So.
Actually, I chaired 2 interim committees. The first one was just a House committee, and that was on local governance.
Yes.
And so we came up with a report that had hearings, had individuals had come up with the St. Louis Metropolitan Statistical Area
Right.
as an entity. And then we had the issues with TIF of the pool tax,
Yes.
revenue sharing. And so the outcome of that first interim committee was to have a joint interim committee looking at local governance. So then the next interim, we got to talk about that. And what that interim committee was to do was to come up with an unbiased entity that would perform study to delve into the St. Louis metropolitan area, the statistical area, the TIF, the Boundary Commission, and the sales tax.
Cool. But I don't think you I don't think you talked about city-county merger there at all, if I'm not mistaken.
That would be under probably the category of the St. Louis Metropolitan Statistical Area, and we did not talk about a city-county merger, though a lot of people who testified wanted to discuss it, and I allowed some of that to happen. But then at the same time, this Better Together was coming about.
Yeah, which is this group. This is the effort to try to get the city of St. Louis to become part of St. Louis County in some form.
Now, just generally, kind of from this experience, did you kind of come away from looking at the St. Louis statistical metropolitan area and think, gee, what a mess, we need to really streamline stuff? Or is it more nuanced and complicated than that?
It's very complicated. You have many, many fire districts. You have the municipalities, the 92.
Right.
You have, and what we've seen now with Ferguson, all the issues of municipal courts. How does a very small community cover their costs? You go north from, I don't know, maybe Page up to 70, and you go by within 5 minutes, probably 6 or 7 different community municipal signs on 170. So that is very complicated. Now, what the issue, and when people talk about the statistical area or incorporation, and some people even talk about Unigov. And so when the discussion comes, I mean, there are people who say, well, are we talking about a Unigov, a merger, or the city becoming
Re-entry.
incorporated like any other?
Yeah,
You know,
and
like
I,
any
Yeah,
other.
just for education purposes, because I'm from Indiana and grew up there. Unigov is kind of the name given to what happened in Indianapolis in the 1970s when Richard Lugar, who later became U.S. Senator, was mayor of Indianapolis. He spearheaded this effort that, in effect, merged the city of Indianapolis with Marion County.
yeah.
So the city of Indianapolis and Marion County are one and the same, except for less than a handful of municipalities that refuse to disincorporate and become part of the
Yeah.
city of Indianapolis.
And-
But that said,
yeah.
that's different than the city of St. Louis re-entering St. Louis
Yes.
County and just becoming a municipality.
Because my understanding is, and this is kind of me going off from covering this, a Unigov situation in St. Louis County where there's one city is going to be difficult, if not
Correct.
impossible.
Correct.
I agree, but there are still people having that discussion. Now, if the city was to become incorporated into the county, one of the key issues that has to be looked at is where did their sales tax?
That was going to be my
Correct.
next question, because this is a big issue right now.
Yeah.
Chesterfield, which is in your district, has now sued to basically nullify, essentially, the sales tax pool. They say it's a special law. I think that was an argumentation that was brought up earlier. But this is an issue where I guess certain cities are point-of-sale cities.
And they get to keep the sales tax that's generated within their boundaries. And then there's the pool cities, where there's a group of cities in St. Louis County who've agreed to pool their sales tax revenue, and then they get
A certain amount of money, basically.
based on population. And the point of sale cities, there is a small portion of their sales tax that actually goes into the pool, a real tiny thing. So yeah, it's complicated.
Now, the controversy with Chesterfield is back when they incorporated in the late 1980s, they
Right.
became a pool city.
Correct.
And this was before it became essentially one of the biggest retail municipalities in the county, if not the entire region. So they basically have outlet malls, they have a mall, they have a thriving commercial sector, and they want to keep more of that money, but they can't because they can't change over into a point of sale city. Hence one of the reasons why they are trying to sue.
Well, but they also, with the development that has occurred, the malls along Highway 40, they have their revenue has grown to the point where they are giving up, I think, approximately or at least close to 60% of the revenues. And they're losing money when they need to provide the municipal municipal services
Because more people are moving to
for their mall. Yes,
Chesterfield.
but to provide the police and fire
Right.
and the maintenance of these malls, they're losing money.
It is also the second biggest municipality now. So what I have found, though, with efforts to change the pool is that it's just, frankly, a moving target. Because for every Chesterfield that wants it changed, there are other municipalities or representatives that represent unincorporated St. Louis County that don't necessarily want it changed because it benefits them somehow. And I've kind of gotten the sense that there really is, it's hard to get a legislative consensus around this issue because no matter what party you're in, it's just that the cities that various representatives represent have totally different views on this. Has that been kind of your impression as well? As that one of the reasons why there hasn't been any changes to it?
Sure, and if you look at Baldwin, Chesterfield, Town and Country, and Winchester, Chesterfield gives up a lot of money. Baldwin is a hybrid, so they had incorporated some, so they have both.
Yes.
And then and Winchester receives the money, and so for me, I'm trying to get some intellectual balance and reason. What I've and with some of the interim committees that we had, the hearings, we have people coming from a municipality that receives pretty much most of, I'll say a significant part of their funds for running their municipal government. And they say, well, we do a really good job with the money. And I would say, yeah, well, you should do a really good job because somebody else gave you this money.
Yeah.
Now, Wildwood is an example. They receive a lot of their funding. You look at Wildwood. Wildwood is a beautiful place. They have a very small retail area. It's like a little village with.
Now they're a pool city as well. Is am I correct?
Yes, because they recently incorporated. There was a certain point in time where all the cities that incorporated became pool cities, and Wildwood, I think, became a city in 1994. I think. So, but basically, what I'm understanding is legislatively, it's just going to be hard to get traction on this issue.
If it goes to the legislature, and there was a bill last year in the House, and I believe Representative Deal was offering to help get some consensus with this, and many of the committee members were less than impressed with the situation that we have in St. Louis County. They couldn't believe it.
Yeah.
And and I say probably when this goes to the state, a lot of the people, and I've said all along, people in St. Louis County need to work. We need to work this out ourselves. But
because in the state level,
it
the
goes
other
to state level,
legislators, we just as soon not
they're
deal
going
with
to fix it, and it's not going to be to people receiving the money.
Yeah.
It's not going to be to their liking.
So let's kind of transition a little bit into your future.
Yeah.
This is your last term in the legislature.
Yeah, you're entering your seventh year.
And I just got to ask before we get to there, you were in the Senate district where Jill Shoup was running, correct?
Yes.
You decided not to run for that race. Is there any reason you decided not to run for the Senate this time, just because you wanted to finish up in the House, basically?
I needed to finish up. I've got, with term limits, and I haven't just shown up in Jeff City to push the green button and the red button. I've worked. And so I'm at a place where I have a very significant understanding of these biggest departments that we have, the largest. And when, Budget Chair Stream was this last 2 years, if there were questions, he would send people my way, and I didn't want to give that up. So I was not willing to do it at that point.
Yeah, I put out a list of people who could run for that seat, including you. It included Colleen Wassinger. It included Dave Spence and John Bruner.
Yeah, we're talking about Republicans.
It included
right?
Cole McNary, and none of them ended up running for that seat. It ended up being Jay Ashcroft and a couple of other people, and obviously Representative Shoup won.
Democrat.
Now, after she'll be in office, I guess her term goes until 2018. Would that be something you would consider in a few years of running for, or is this basically your last couple of terms and then
last couple of years,
it's pretty much over at this point?
I don't know. 2 years is a long time. I would have 2 years out.
Mm-hmm.
I'm certainly not ready to come home and do needlepoint or anything like that. But I'm not ready to commit.
Yeah, I mean, we're asking about a race 4 years in the future.
Right.
That's fair. But you were talking about
term limits. What are your thoughts about term limits now that you're going to be affected by it after this term?
Well, I voted for term limits.
Okay.
And again, I never planned to be a representative. I have a wonderful profession. I was happy. But it just happened. So I voted for term limits, and I was not aware of really what happens with term limits when you have people come in, in and out, a maximum of 8 years in the House and or the Senate. In a sense, what we end up with is the bureaucrats and the lobbyists are the individuals who have the historical knowledge. And one of the things I've done, we started doing this our freshman term, was create the freshman focus, which was to bring, for our existing class, was to bring in different analysts, our chief clerk of the house, our budget director, people who have been there, and different people who had been in various, departments under other governors, and become become better informed. And then through my second and third terms, I also worked with the Republican caucus to do that, to mentor and to help people do a better job of hitting the road running, at least with some movement.
Would you like to see a change in term limits, or?
Oh, I definitely would, and it wouldn't affect me, I'm sure. But I think, and we have 8 years in the House, 4 2-year terms, and we have 8 in the Senate, 2 4-year terms. I think if we had any combination of 16 years, I don't think somebody needs to be there for 30 years. And though you do have people say, well, what is the factor? We have elections that can affect somebody coming and going, but there's still a point. I think a limit is okay. I would like to see any combination of 16 years, because what happens is when you have in a Senate district with 2 or 3 really good people, what do? They fight each other in a primary.
You mean the legislators,
Yes.
the House members? You have
I'm
2 or 3
sorry,
House
yes.
members
The
who are
House
then running for
members
the Senate seat.
are going to battle for 1 Senate seat, and you lose the impact of people who have been there for 8 years, but you only get 1 senator.
Yeah, that's definitely happened in a lot of other districts. You're in a district that is a little bit different in the sense it's a competitive seat where in the general, but that definitely happens where there's the primary is essentially the general for both sides. So we're running a little bit low on time, so we're going to stop it there. Thank you so much again for joining us. To close this out, you can follow us you could find our work at stlpublicradio.org. You can follow me on Twitter at @JRosenbaum. You can follow Joe at
J Mannies, that's JMANNIES.
My email is sue.allen@house.mo.gov, and I do believe that on my website I have a Facebook and a Twitter.
Well,
Okay.
very
Well,
good.
thanks so much.
Everybody is technological these days. We'll be back next week. Until then, so long.
Thank you.
The Gateway brings you the day's news from the St. Louis region and across Missouri. It also includes stories from the Illinois side of the river and our Metro East reporter, Will Bauer.
In Alton, in Belleville, in East St. Louis, in Edwardsville, in Cahokia Heights, at Scott Air Force Base, I'm Will Bauer. St. Louis Public Radio.
Listen to reports from Will and all of our journalists weekdays on the Gateway, on the STLPR app, and wherever you get podcasts.